seventh question, we have to understand the concept of mitral valve stenosis. So, what exactly is the mitral valve? Well, mitral valve is the valve present between our left atrium, this is the left atrium, and the left ventricle. This is the mitral valve. So sometimes what happens is that it gets stenosed. Well, there's actually two things that could happen to a valve. It's stenosis or regurgitation. Sometimes it happens that it gets stenosed, it gets calcified. Normally it happens in patients who are having rheumatic valve disease. So when that happens and the mitral valves, they get stenosed, what happens is that every time the blood has to go from atrium into the ventricle, that is during the diastole, right? It has to open these valves up, but since they are calcified and they're stenosed, narrowed down, so it always opens with a snap. Like snap is a bursting sound, like it bursts open the valve and then the blood rushes into the ventricle. So in these patients, we will have during diastole, we will have a snap opening kind of sound heard every time the diastole begins. So let us now just go to our question and see if we can solve it or no. Okay, so let us now head to our question. Question number 7. A 34-year-old woman who recently immigrated from Russia comes to the physician due to the weakness, exertional dyspnea, and orthopnea. On cardiac auscultation, a snap followed by a rumbling diastolic murmur is heard over the cardiac apex. The snap most likely occurs near to which of the following points on the cardiac pressure loop? So now if you have studied my question number 6 with me, then you would know what is a pressure volume loop, right? So we're just going to quickly go through over it. So point A in this cycle is basically the end of diastole. It's where the diastole ends and systole begins. Point B is where the valve opens and the blood shoots into the aorta. Point C is where the systole ends and the ventricles start to relax. And point D is the beginning of diastole, where the ventricles are completely relaxed now and they start to, and the valves, the mitral valve, it opens. So where do you think a person who is having diastolic rumble following a snap would have that snap in this cycle? Well, first we have to establish the diagnosis. A snap is followed by a diastolic rumble. A snap before diastole, what does that tell you? The snap is happening before the diastole. The diastole happens immediately after the snap. So snap open the mitral valve, diastole happens. Where is that snap happening? So where is the diastole beginning? Point D is where the diastole begins. I'm going to go through over again. A point is diastole ends. B point is the valve opens, systole begins. C point is systole ends, and D point is diastole begins. So the point where diastole begins, the point where the blood shoots from atrium to the ventricle, that's where the snap is going to happen. That's where we heard the sound. Boom, you know this MCQ. You got it.